अस्सलाम वालेकुम इय्याका नअब्दु व इय्याका नस्तईन। वेलकम टू माय चैनल डॉक्टर शामी सेज। तो आज की इस वीडियो में मेडिसन 23 फरवरी मॉर्निंग का मैं पेपर करने जा रहा हूं। तो चलें स्टार्ट करते हैं। क्वेश्चन नंबर 1, इन द 9th इंटरकोस्टल स्पेस ओवेरियन कार्सिनोमा सर्जरी डन विच स्ट्रक्चर विल बी डैमेज, दैट इज द 9th इंटरकोस्टल नर्व। क्वेश्चन नंबर 2, रिस्पिरेटरी एक्सचेंज ratio value for the oxidation of the glucose to carbon dioxide in the water is beta 0.8. Question number 3, hyperkalemia is associated with the flaccid paralysis. Question number 4, the patient taking isoniazid, rifampicin, pyrazinamide, ethambutol and the pyridoxine for the TB now presented with the raised bilirubin and deranged LFTs. What to do now? Stop all and reintroduce one by one after monitoring. Question number 5, rat bite cause fever by the toxin, that is the Streptobacillus moniliformis. Question number 6, childbirth is example of which of the following, that is basically the alpha positive feedback. Question number 7, the patient with the complaint of the regurgitation, chest pain, night partially relieved by the elevation of the head side, frothy like liquid is coming from the mouth. What should doctor advise? Decrease the fatty diet. Question number 8, diabetic patient present in the OPD with the oozing greenish discharge from the wound. Which of the following is the causative agent, that is delta pseudomonas. Question number 9, the patient whose small gut is resected due to the Crohn's disease. Patient with the hyperoxaluria, the cause of this condition is Charlie, increase oxalate absorption from the gut. Question number 10, finger injury which activates the kinine and also the coagulation by which factor? It is basically beta, which is the Hirschman factor. Next, question number 11, a 5 years old male presented with epistaxis, gum bleeding time more than 20 minutes, increased APTT. Suitable diagnosis is the Wolverine disease. Question number 12, immunity against the COVID-19 and the tumor cells is of the NK cells. 13, the first step in the thyroid hormone synthesis is oxidation of free iodide. Question number 14, the female, the short stature, hands, swollen neck and is now 20 years of age with amenorrhea and absent secondary sexual characteristics. This is basically Charlie 45X Nello Turner syndrome. Question number 15, the qualitative change in the gene expression is alpha the point mutation. Question number 16, the bone scan necessary for retinoblastomas. 17, homosexual male HIV positive has the fever, dry cough and the weak atypical mycobacterium shown. The cause is mycobacterium avium intracellularly. Question number 18, a disoriented old patient was brought in emergency by his wife, complains of the right flank pain and the vomiting. Diagnosis of acute appendicitis was made and the urgent appendectomy was suggested. Patient did not give consent for the surgery. Next step would be take consent from the wife. Question number 19, beta cell markers used for their identification in a tumor is Charlie CD19. 20, 53-year-old male had the non-productive cough for the 2 months. Now he presented with the blood streak sputum. Left lung has the 5 cm hilar mass. Sputum shows the hypochromatic pleomorphic cells with the scanty cytoplasm. The cause of this condition is radon exposure. 21, regarding the bronchial asthma, the most probable finding will be delta FEV. Our FVC is less than 75%. 22, the obstructive lung disease with the decreased oxygenation, the retention of the carbon dioxide, hyperinflation of the lung on the X-ray. Likely diagnosis among these is the emphysema. 23, the patient after the gastric content in the supine position, aspiration will lodge in which of the following apical segment of right lower lobe. Next, 24, the thrombocytopenia is the side effect of the quinine. Next, 25, the hostile after sexual contact develops sores on the genitalia and the palm soles. What is the likely treatment? Charlie, the penicillin. 26, the renal part which run from the renal cortex to the medulla between the renal column is beta renal pyramid. 27, young girl with the blisters on extremities, type of the flood present between the dermis and epidermis is the serous. 28, the arterial bronchus supplies to right man bronchus. Next, 29, the patient with the diazepam overdose, the antidote of the diazepam would be the flumazenil. 30, the patient complained of the chest pain, specific gravity less than 1.025, protein content less than 3 gram, pericardiocentesis done, flood is called the transitive. The patient having the portal hypertension present with the esophageal varices having the bleeding, which vessel is involved? Left gastric vein. 32, regarding Parkinson's disease, the treatment is levodopa startly to decrease the prolactin. 33, only sensory supply to the brain is the Charlie, the optic nerve. 34, the squamocolumnar epithelium present the center above the cardia and of the esophagus. Diagnosis is the Barrett's esophagus. Next, 35, the person has a traumatic incident of upper limb for the 3 months. He feels pain and the tenderness of swelling develop at the region on the X-ray. Swelling is bright. After 1 year is resolved. The phenomena is the metaplasia. 36, the patient presented with the decreased BP. Which of the following will secrete enzyme to normalize the BP? The patient, that is juxtaglomerular cells. 37, the person got injury. Which muscle will be sparred in the C81 injury? That is the pronator quadratus. 38, the 58-year-old female diabetic for 20 years, abdominal distension after meals due to the diabetic gastroparesis. Which of the following is the most suitable suitable drug for the treatment. It is the metoclopramide. Intestinal motility is affected by delta VIP, vasoactive intestinal peptide. 40, opioid induced vomiting through which of the following the chemoreceptor trigger zone. Next, 41, arteries running at the back or the floor of the stomach is likely to cause the bleeding. This is the splenic artery. O negative blood transfusion, AB positive. What is the secondary blood transfusion reaction? The hemoglobinuria. 43, temporalis insertion is on the coronary process of the mandible. 44, the anterior dislocation of the femur on the tibial ligament. Damage is the posterior cruciate ligament. Next, the 45, about the cartilage. What is true? The organophosphatase is reduced by the osteoclast. 46, the sternal angle at which vertebral level, the T4, T5. Which of the following is locally malignant tumor? That's ameloblastoma. 48 is the following is more aggressive tumor, that is the melanoma. Next, 49, the person with the hypertension and the bradycardia, which of the following is the present along with which raised ICB. 50, the two person sitting room athlete and other man, what former will have increase in the cardiac output. 51, at the end of the marathon race, a person has high glucagon and the low insulin. 52, most abundant cells, the gray matter of the CNS are delta protoplasmic astrocyte. 53, girl doing exercise heavily to maintain fitness, there will be decrease in the skeletal muscle vascular resistance. Next, 54, the brain stem parts include the bones medulla and the midbrain. 55, the section of the caudal bones consist of the horizontal fibers. These fibers most likely consist of the beta, middle, cerebral peduncles. 56, long term control the homeostasis after a few months is by which mechanism the formation of the brown fat. 57, the deficiency of the niacin causes the Charlie the pellagra. 58, the niacin deficiency causes which of the following affect the CNS defects. 59, ECG of patients show the progressive prolongation of period interval in the recessive beats followed by the drop beat, that is definitely the Mopitz type A block. 60, the patient came in the emergency with the failing heart, drug of choice in the heart failed would be the dopamine. Next, patient came in the semi-conscious condition. C7 analysis shows glucose, this protein, this is basically the partially treated meningitis. I can't read these too clearly. Next, 64, the patient present with the central chest pain, sweating and the vomiting. The cardiac enzyme which would be raised is CKMB. 65, the most common carcinoma of the thyroid is beta papillary thyroid carcinoma. 60 is the patient with the ptosis and the mydriasis likely to damage oculomotor nerve. Next, 67, norepinephrine senses require which enzyme? The beta dopamine hydroxylase. 68, the small amount of the blood loss for the longer period of the time. Alpha, the iron deficiency in which of the following occurs due to the sympathetic stimulation, that is basically delta, the bronchodilation. 70, the pregnant female not taking the supplement in the pregnancy, she will have the deficiency of the folic acid. 71, the neurotransmitter in the slow type C fiber is Charlie, the substance P. 72, during the near vegan what happens? Beta, the ciliary muscle contraction. 73, the teeth grinding during the sleep indicates what? That is the non-REM, NRM, non-REM sleep. 74, intentional tremors in the jerky eye movements occur due to the cerebellar lesions. Next, 75, the function of the cerebellum include this is Charlie, the muscle coordination. Next, 76, the age estimation from 5th to 12th week is done through alpha, that is the crown rump length. 77, the hemiblasmus occurs due to the damage in the subthalamic nucleus. 78, the 7-year-old child presented with the cough and the mucus increase. Eosinophilia X-ray shows the hyperinflation. Likely diagnosis is the bronchial asthma. Next, 79, a lengthy scenario of hepatocellular carcinoma. Next, 80, 13-year-old young patient admitted in the emergency with a complaint of the dyspnea and the diarrhea. The clubbing present examination. This is cystic fibrosis. On light microscope, skeletal muscle under low magnifying characteristic feature is the light and the dark bands. 82, mastectomy with the patient done and after and a muscle was damaged. After that, the patient can adduct and extend and internitrate the arm. Which muscle is damaged? That is latissimus dorsi. Jaw reflex is mediated by the cranial nerve number 5. 84, the preoperative male on the list for the surgery having 21 HP, 65 hematocrit. What should be done? The venesection must be done. Next, 85, the superior pole of the thyroid is ligated artery supplying. This originates from the external carotid artery. Next, 86, the patient after transplant develop visual problem, the diarrhea on the examination cells with the basophilia and inclusion same. This is due to which of the following? That is delta cytomegalovirus. 87, the patient suffering from the dysphagia, dysarthria, analgesia and the thermoanesthesia on the ipsilateral side of the face and ipsilateral Horner syndrome. Occlusion, which of the following artery will produce these sinus symptoms? Alpha, the posterior inferior cerebral artery. Next, 88, the frontal cortex ligand will more likely effect upon the Golgi tendon organ. 89, which of the following parts of the body has the cortical neurons with the largest representation of the primary motor cortex area number 4, that is the finger. 90, the bilateral all sensation lost due to beta total spinal cord hemisection. 91, the slowly growing thyroid tumor is the papillary. 92, edema in the retina occur due to Charlie diabetic mellitus. 93, the long-standing hypertension leads to the heart exudate. 94, the child is lethargic, weak mentally in the school, having tough due to the aortic overriding and the ventricular septal defects. 95, the specific characteristic of the right ventricle is alpha, the right pulmonary trunk arises. Next, 96, the major motor supply to beta shoulders. EEG of the patient shows the A wave because the patient is voluntary, eyes closed. 98, the patient loses 2 liters of the sweat while working and that drinks 2 liters pure water. Which changes will occur? There is a delta increase ICF volume. 99, ADH causing the following effect: alpha, increase permeability through the collecting duct. 100, a patient has the chronic chest pain, irregular pulse and diagnosed in atrial fibrillation. He is unable to walk and falls suddenly and cannot reach his phone. Emboli from the atrial fibrillation lodge in which of the following artery? That is the anterior cerebral artery. 101, armed officer is habitual of awakening early in the morning. Circadian rhythm is controlled by which of the following? Suprachiasmatic nucleus. 102, 7-year-old child having the sodium 110, potassium 3.5, urine osmolality 620 millismol causes beta CR. 103, the patient diagnosed case of the carcinoma and the treatment with the radiation treatment of carcinoma of the radiation decreases is size by the ionizing free radicals. 104, which of the following inorganic component is carcinogenic? That is the asbestos. 105, which of the following has the intra-articular tendon? That is popliteus. 106, which of the following has the auricular tendon? Again popliteus. 107, left lower lobe lung differ from the upper lobe lung by not having apical segments. 108, total body water is calculated by the antipyrine. Next, 109, more growth in the human beings occur in which age group? That is adolescence. 110, the pregnant lady with the labor pain and the obstructive labor was taken to the hospital but died before reaching the hospital. Most likely the cause is amniotic fluid embolism. Next, 111, the patient with HbF 5 enlarged spleen, the recurrent blood transfusions, increased fat in with the retic constant for 12%. Which of the following the diagnosis? That is the thalassemia major. 112, the best thrombolytic agent is Charlie tissue plasminogen activated. 113, the pulmonary artery clotted with what will increase in the affected lung side? That is the ventilation perfusion ratio. 114, the patient had difficulty in standing and the waddling gait. Nerve involved would be the superior gluteal nerve. 115, the pregnant lady in the first trimester having HP of 10, third trimester having HP of 9. Most likely it is due to the Charlie, which is the plasma volume excess. Next, 116, which is the following increase in the pregnancy red cell mass. 117, the patient having the traveler's diarrhea not responding to antidiarrheals. Which drug should be given? Charlie or fluoxetine. 118, 16-year-old with a 15-year history of the diabetes. How to check long-term glycemic control? The glycosylated hemoglobin. 119, the patient having the problem with the urinary outflow and large is metrical form, nodular prostate was palpated. He had no fever and chills and PSA level was 3.5. What is the likely diagnosis? The prostatic carcinoma. A patient with the abdominal pain, MRI done. Diagnosis is the duodenal carcinoma. Which one secretes from the tumor? It is basically delta option, but it is secretin. It is not statin. Right option is secretin. Next, 121, the patient known case of HPV having cirrhosis. Most common cause of the secondary hyperaldosteronism is the Charlie Renin. 122, the pregnant lady 10-week pregnant aspirin given. What is the beneficial effect of the aspirin? Inhibition of cyclooxygenase pathway. 123, the best host defense in the alveoli is the alveolar macrophages. 124, the patient went to Thailand and present the diarrhea which is watery and there is basically the donor-shaped cyst and it is the cryptosporidium. Next, 125, the plasma cells produced by the beta cells. Okay, you have to rectify this one too. Next, 126, the hospital public transport system in the ethics is the systemic support system. 127, the regarding preferential thoroughfare channels, correct statement is beta having smooth muscles. 128, the hypertension in the kidneys as compared to the normotensive is alpha, increased sodium effect more than the other. Staging of the tumor is done for the tumor size and the spread. 130, the extrasystolic beat would produce delta, decreased pulse pressure because SV is decreased, systolic volume is decreased. 131, the maximum ventricular filling in the first third of the diastole. 132, the function of the lactoferrin is Charlie, the prevent iron utilization by the bacteria. 133 buffer found in the kidney but not in the plasma is the ammonia. 134 a 38-week pregnant woman visited her family at a remote area after which she developed jaundice. Suddenly, which type of the hepatitis is most likely present in the pregnant woman? That is the hepatitis E. 135 the pleuropericardial membrane fused to form the fibrinous pericardium. 136 the patient had the cough and X-ray shows the hilar lymphadenopathy, non-caseating granuloma present. Diagnosis is that is basically alpha because it is non-caseating. 137 antibody in the allergic rhinitis is IgE. 138 the chloride transport in the loop of the Henle is by the counter transport the sodium potassium channel. 139 the parasympathetic decrease heart rate by the effect on the Charlie sodium and the potassium. 140 the female patient with the pain in the first metatarsopharyngeal joint due to beta the gouty arthritis. 141 the fat digestion is done by alpha emulsification bile salts bicarbonate and the lipase. 142 myiasis of the nose is caused by Charlie the viral disease. 143 with regard to counseling, the best statement is it is a technique to help people themselves. The minimum air blood barrier is formed by the pores of the colon. Next 145 there is a bilateral damage of the glossopharyngeal nerve. It carries which taste, that is the bitter taste. Oxygen toxicity occurs at 100 atmosphere in 48 hours. 147 migratory motor complex is triggered by the motlane. 148 the chromosomal maneuvering does not occur in the sexual reproduction. Next 150 the cervical branch of the facial nerve supply beta the platysmas. Next 151 the HIV infected patient the 300 centimeter CD4 cells with respiratory symptom cause is pneumocystis. 152 the relay cell mediated hypersensitivity is by the contact dermatitis. Next this one lengthy scenario is going towards the type 2 hypersensitivity. 154 the regarding the atypical spinal nerve is formed in the intervertebral foramen. 155 the decreased ventricular muscle fiber length in which of the following there is increase intrapericardial pressure. Next 156 the secondary immunodeficiency is due to the decrease in the CD4 cells. 157 the pregnant lady came with the premature rupture of the membrane. She is suspected to have chorioamnionitis. To confirm intra-amniotic infection, what test should be done? That is the interleukin 6 level. 158 ligament made by the thickening of the parotid fascia, the stylomandibular ligament. 159 the chenodeoxycholic acid decrease turnover in the Charlie the ileal resection. 160 the patient presented with the urine output of 1.4 liter, plasma flow of 144, urine flow of 140. Calculate the creatinine increase, it's 168. Had a core accident after which he is bedridden. He develops DVT. He came to ER with the chest pain and the dyspnea. What will be the findings? Beta increase VQ ratio. 162 the peripheral chemoreceptors are stimulated by the Charlie decrease oxygen. 160 the ABGs reveal the pH of 7.54, partial fraction of carbon say 40 and the bicarbonate 38. What is the acid base disorder? It is uncompensated metabolic alkalosis. Next last one here, the therapeutic dose of the drug indicates alpha which is potency. Thank you for watching this video. Do subscribe my channel. Until my next video, Allah Hafiz.